All right, as we're welcoming people back into the room so we don't lose too much time, we're going to go ahead and get started. And it's my great pleasure to introduce the next speaker who's going to speak to us on transformative partnerships. And he's also someone I have a great privilege of working with. This is Dr. Michael Blum, who is a practicing cardiologist and as we speak is on service, so took the UCSF zip line down here from the Parnassus campus to be able to participate and provide us this great talk today. He's our CMIO, our Assistant Vice Chancellor of Informatics, and also the Director of the Center for Digital Health Innovation, and a practicing cardiologist. So I really like to turn this over now to Michael.
Thank you, Einer. You'll have to bear with me if my phone starts ringing, but we'll see if we can make it all the way through this. Thanks everyone for coming. I hope you've had a wonderful morning so far and a great day yesterday. Conference is getting good reviews already. It's amazing how you can hear all about a conference before it's even halfway over. So I'm going to take a couple minutes to talk about some of the transformative partnerships that are going on and how we see them from our healthcare perspective and why we think this is critically important in the digital health space. And then we're going to have a panel with some of our partners to talk through that. So let's see what kind of success we have here with the clicker. All right, so I always like to anchor these talks since we tend to be focused on technology and we tend to be focused on deals we're doing. It's always important to me to come back and anchor this to why we do this work. And these are just two typical examples of patients and individuals that really help frame it for me. On the left is a young, healthy 40-something who comes into the office and wants to know what we can do to prevent heart disease for him. His dad died of an MI at a very young age, and he just had his first kid. And his wife sent him in to say, how do we avoid me having cardiovascular disease? I'm young, I'm healthy, I run all the time, I exercise. What can I do? And unfortunately, our answer to him is, well, we don't really know. You know, your dad was overweight, your dad was a smoker, we don't know how much in common you have with the traditional cardiac risk factors. So based on your cholesterol, maybe you should take this drug for the rest of your life. Not a particularly satisfying answer. The gentleman on the right is a grandfather who loves spending time with his grandchild, and he is given a whole bucket full of pills to take on a regular basis. Takes 22 pills a day and hates it, absolutely hates it. Yet some of these medicines have been shown to fundamentally change the outcomes in heart failure. People live 10, 15, 20 years who would have died in 2 or 3 years previously. The problem is we don't know which of those pills for him as an individual are particularly important and really change the course of his disease. So I unfortunately have to keep encouraging him and sometimes berating him to take every one of those, despite how lousy they sometimes make him feel. So we're currently practicing in this age a fairly imprecise medicine. We have guidelines and we have guesses and we have a lot of outcomes, but we can't really tell each individual what's going to happen to them and how they really need to react and interact with the system to get those great outcomes for them as an individual. And where we really need to move is to precision medicine. Moving to precision medicine is a fundamentally new concept, and it's a new take on things that is a whole generation past what you heard as personalized medicine. Personalized medicine was we're going to be able to sequence your genome, and then we were going to be able to give you all the answers that you needed for prevention, for wellness preservation, and for disease management. And it was a bit of fantasy. It turns out that it's far more complicated than that. We need far more research. Our research and our clinical care need to be brought much closer together. And we need fundamentally much bigger data sources. It's not just the genome, it's all of the omics. And it's your life, it's your parents, it's how you were born and brought up, and it's everything you've been exposed to throughout your experience that's affected you, it's actually affected your DNA, and all those things together are what we need to know in order to figure out how to treat you. What's relevant here is that digital health is a huge piece of that. We've got to reach outside of the traditional care paradigms, and this is nothing new to any of you, that we've got to really embrace the sensors, the new devices, mobility, the new analytics. We've got to be able to bring the patient into the healthcare experience. We've got to have much better patient engagement. And we need fundamentally new, incredibly large data sources to really inform where we need to go to make that move from imprecise medicine that we have today to the precision medicine that's hopefully not too far off in the future. So we certainly have plenty of new connected digital devices, and you guys have all seen many of these. Several of these are actually getting aged by now, but the point is that well individuals who are interested in preserving their wellness and patients with chronic disease can already be digitally connected. The care experience, the providers have fundamentally moved from being tethered to a computer to having mobile devices and communicating with them. The providers are ready to interact with the patients and to fundamentally change that patient experience to where you might not even need to come into the office anymore to have management or to have wellness visits. So the trick now is really to combine these new large data sources, to combine the electronic health records and very large databases that the patients are participating in, all of the omics data that is explosive and huge, using new analytics, new corporate partnerships, new industry tools to really get to that understanding and all that data. So we can turn that data into information, into wisdom to circle back and tell those two patients what individually matters to them. So this hasn't been lost on industry and in the investment community. You guys have probably seen this slide from Rock Health several times that in 2014 there was $4 billion invested into the digital health space. Quite the rage now, and people are starting to wonder if it's becoming a bubble. Just the other day, that got added to in a very big way with the Fitbit IPO. It was the biggest IPO of the year, and the stock price jumped 60% even after, on the first day. Made a lot of people very rich and very healthy, and led to this belief that everything is good and everything is going along, and we're all going to be successful in this space. So lest you get sucked in any further to how wonderful things are, from MarketWatch, there was, this is not all roses. In this opinion, they hate Fitbit, and you should too, that this is all hype, that there's actually no contribution to wellness, there's no understanding of what these devices do, despite the fact that the president wears one, and that we're not really contributing to wellness and to disease management and to fundamentally shifting healthcare just because people invest a lot of money in devices like this. They do make money, but how are they really contributing to better understanding and better health? How are they partnering to really do that? And they actually partner with us, but there needs to be much better understanding of what's going on here. So this is a fairy tale that supports all that and supports the huge investment and supports a lot of the enthusiasm. And we get this all the time. There's a new startup comes up from Menlo Park or Palo Alto. Somewhere in Silicon Valley, some engineer has figured out a new sensor, a new way to Bluetooth connect some revolutionary sensor to an iPhone or to an Android and sends it up to the cloud, and from there, everything is better. Once the data gets measured and gets up to the cloud, all is good, is the fairy tale. And the end of the fairy tale is that your doctor is actually sitting there waiting for this new data that you've collected. They have nothing better to do than stare at their computer monitor and wait for this data to come in. This is the reality. All this stuff is true. They've invented this great new sensor. Don't know if it works or not, but it certainly connects to your iPhone, zips up to the cloud, and that's where it all ends. Because it all sits in the cloud. It doesn't come to your doctor, and your doctor's not sitting there waiting for it. Your doctor's sitting there pulling their hair out because they've already got too many patients, their reimbursement's going down, the government is all over them for everything, and they've already got tons and tons of data. They don't need, nor do they want, more data. What they want is information and knowledge and wisdom about how to take care of you as an individual. This last part is critically important, and it's only going to come with a reframing of the thinking that's happening in industry and the thinking that's happening in academia to really move us to that precision medicine. So what's missing? There's a fundamental disconnect between how industry thinks about the problems of healthcare. We did this really well in biotech, and there have been huge corporate partnerships with UCSF for a long, long time. We've mastered this in the life sciences. Big building right over there, Genentech Hall. Genentech came out of UCSF. Some people say half the biotech companies in the Bay Area came out of UCSF. So this is not new, partnering in an important way with industry. The difference is when we talk to the technology industry, the engineers are looking at traditional approaches and not approaches to biological systems. The complexity of healthcare is really, hasn't penetrated the depth of it into the technology spaces to develop the kinds of partnerships that truly understand what it's like to develop new systems for biological entities, not banks, not manufacturing, but humans is a whole order of magnitude different than developing the kind of partnerships you need to transform other industries. The difference from the life sciences to the digital technologies is that the industry thinks about it very differently. The time frames are very different. In the life sciences, it's going to be 10 years before my product makes it to market. In digital health, if it's 10 months, we're out of business. So very different time frame. In the life sciences, the FDA and regulation were just part of the landscape. When we talk to digital health companies, you can see the hair on the back of their neck go up and their blood pressure go down when anyone says FDA. The FDA ruins the whole business plan, but it's a reality in healthcare and in the life sciences. So the other piece is the life sciences companies, the biotech startups, this is where they came from. They came from healthcare academics, so they knew what they were going to see. Engineers and businessmen haven't lived in this space, so they've got to be able to get out of their comfort zone, and that's going to require more experience. So we're talking about transformative partnerships and how we're going to create more and more of those. And I just wanted to touch on a couple of projects that we've already walked through, and then you're going to hear about Healthy Heart in a while from the panelists, which is really transforming a whole industry. So at the Center for Digital Health Innovation, our focus is on innovation, that's internal innovation, working with external partners, and validation. The validation component really addresses that issue of, okay, you've invented something, let's make sure it works in healthy people, let's make sure it works in people with a chronic disease, and let's make sure it brings value back to the healthcare system. You've invented something, but is it important? Is really, does it work, and is it important is the validation step. And then the integration step is what you saw where the fairy tale ends of getting that data back into the system and educating the next generation of providers, the next generation of engineers and digital health experts, educating the investment community about what these partnerships need to look like. So we've got a whole slew of partners already. I think there's already been some talk about our partnership with Samsung at the Digital Health Innovation Laboratory, and that's really focused around that first component of doing the validation. A consumer company coming to healthcare and saying, we want to invent and we want to create and manufacture consumer devices that preserve wellness, but we need to be sure that they're actually important. And that's generated a lot of work for the Digital Health Innovation Lab. So long list of partners, large and small, who we've got these kinds of novel partnerships where the partners understand that being in healthcare and partnering in healthcare, inventing in healthcare is fundamentally different. So let me just take a couple minutes to talk through these two topics of really transformative partnerships. And the first one I'm going to start with is Tidepool. And this is where it starts. Tidepool is a type 1 diabetes company. Type 1 frequently in younger kids, their pancreas doesn't work, so their blood sugar is very, very difficult to control, and they usually need insulin to control it. This is a life or death issue. Too much insulin, glucose goes too low, seizures, brain damage, horrible outcomes. Glucose goes too high, long-term complications, comas, terrible outcomes either way. So you need to get this right. And these are kids you're talking about, so the kids need a lot of help from parents. So they typically have, in contemporary, state-of-the-art treatment, they have on the right is an insulin pump that delivers subcutaneous insulin regularly so they don't have to give themselves shots all the time. And on the left is a continuous blood glucose meter. So this is really cool. You got some great technology, helps manage it. You don't have to figure this out all the time. They look at the pump and the meter and they can figure out what they need to do with the pump. And it seems like this all makes sense until you look at the data side of this, which very much reflects the old world. These are all made by different manufacturers. Each of those manufacturers believes, or at least believed until very recently, that they own the data. The device was theirs. They had gone through the regulatory process. They owned the data, and it was their asset. We take a fundamentally different approach to this. Ours is that the data is the patient's data, and that the patient owns it, and the patient has a right to do with it as they want. And so there was a lot of problem here because each of these devices captured the data that went to the vendor's proprietary website, and you couldn't really do anything with it. So the progress came, and you've probably heard a lot of exciting announcements from companies like Apple around HealthKit, where now you could take some of that data and move it into the electronic health record, and everyone applauded and thought we were all done. Not even close. This is what you end up with when you can import some of that data. You end up with pages and pages and pages of this. Useless spreadsheets that providers are supposed to go through, or provider can go to each website individually and try to figure out how to put that picture together. When Tidepool went to the vendors and said, hey, give us this data, we're an analytics company or a visualization, we can do much better with this data. Each of the vendors said, no, 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 our data, you keep your hands off it, this is ours, and we'll deal with the patients. And we said, you're not dealing with the patients very well. This is not helpful in a 15-minute visit to have to go through pages and pages of this. To ask you what happened 3 months ago at 2 o'clock in the afternoon when I see a bad number in there, not helpful. So this is a great story of how technology, creativity, and persistence totally disrupted an industry through a transformative partnership. So the partnership was Tidepool, a not-for-profit, UCSF, and a bunch of dads who were really fed up who came from the technology space, and they built this. So what they did was they went and they said, this is the patient's data, this is our children's data. They created a web front end that the individuals logged into, put their credentials in that got them to the web portals of the various manufacturers, got the data down, and created the kind of visualization that totally transforms healthcare for this population. Now, instead of just looking at spreadsheets of glucose data, we can actually see what the insulin delivery has been, what the carbohydrate intake has been, and what the glucoses have done in response to the insulin. And now you can actually see information rather than just long pages of data. So we're currently studying this at the Madison Diabetes Clinic, and this is really getting traction now as what the future will look like for management of type 1 diabetes and how the research community will look at this. So this gets to another important point of these transformative partnerships is a lot of the things that we think we know in healthcare have been based on these clinical trials that are very controlled and in a lot of ways don't reflect the reality of patients' lives. So in this case, you had people who would come in for a couple of visits a year, have parameters measured around the diabetes, their hemoglobin A1C, their glucose, and then some other things that would look at side effects. But that's not what happens day by day, hour by hour in real life. It's the same thing with blood pressure. Blood pressure as we know it, what should be normal, was done out of clinical trials that were very controlled, as were the treatments. But we don't know what happens to people every day throughout their lives. So digital health is going to have a tremendous impact on this because the data is now going to be available to us. Streaming sensors are going to now tell us what happens throughout a patient's life, throughout an individual's life. And we're going to have to redo all those clinical trials with new alliances that are very large and don't have hundreds or thousands of patients in them, but have hundreds of thousands of patients in them and millions of patients and data throughout their lives. So that gets to the Healthy Heart study. This is a new concept in clinical trials. Clinical trials are why drugs cost so much. There's huge cost to the drug development, but then planning and running the clinical trials and each phase of the clinical trials is hugely, hugely expensive. And one of the biggest components of that is the ability to enroll patients and keep patients in the clinical trials. And as you get to diseases that are more and more difficult to demonstrate an outcome, you need more and more people in the clinical trial. So the problem is that having centers and having people have to come to the centers, having to have them find out about the clinical trial from their doctor, doesn't work, is incredibly expensive. So in cardiology, the seminal trial about cardiac risk factors was the Framingham study, and it was done about 50 years ago, over a period of 50 years, and had 4,000 patients in it. So the Healthy Heart Alliance and trial is basically redoing that in the digital age. So instead of 4,000 to 5,000 patients, imagine 400,000 to 500,000 patients using web technologies to enroll them, to engage them, to consent them, to reach out to them all the time with surveys, to have sensors that are deployed that the study is accumulating data from in real time over periods of years instead of 2 checks a year across the study. The enrollment has been fantastic, and we'll talk more about that as we go forward. So in the last minute, I'm going to talk about what I think we're going to see, some predictions for 2015, and what we're doing next in this space. This is the Gartner hype cycle, some of you have probably seen. And I think where we are now is here. Oh, you really can't see that. We're at the peak of inflated expectations right now. Everyone thinks that digital health is going to be wonderful. Industry is going to make $1 bazillion out of this. We're going to solve all the problems of healthcare. And that's the peak of inflated expectation. You see this every time a new technology or a new industry comes out. The risk is that we end up creating a bubble and then we crash down into the trough of disillusionment. That's when reality sets in and the investment goes away, and then we all sit there looking very sad. So our job here is to avoid that from being a big dip and then coming out onto the slope of enlightenment and then moving off to the plateau of productivity, to really make that not a steep down slope by really doing that validation, by really having partnerships that avoid the hype and move it on. So what we're going to see much more sophisticated sensors. We've seen the Fitbits and the first generation of heart rate sensors. You're going to see much more multi-parameter sensing. You're going to see difficult things being done like glucose and blood pressure sensing in much more sophisticated ways. And you're going to see alignment through analytics of multiple parameters that'll be far more powerful and important. We're going to be moving from just measuring your exercise and measuring your calories to actually measuring and managing chronic disease. The payment models, the ACOs and accountable care are going to drive to the need of really being able to predict decompensation, to be able to manage these things much more effectively. And the sensors are there. We're going to be building the connectivity to the health system to make these things happen. And the Blip application from Tidepool is a good example of that. Telehealth is going to explode. You already heard about that today. It's going to become much more pervasive, and you're not going to need to come to the office for many of these kinds of visits over the next couple of years. And finally, you're going to see integration. You're going to hear announcements over this next year of that last mile problem being solved. You're going to see integration between the new digital health sensors all the way through meaningfully with processing and analytics and algorithms run on them into the electronic health records of your provider, so your provider is now getting information and knowledge about you rather than just seeing streams of data coming in. We're anticipating partnerships being announced that over the next 6 months and then over the next year build that'll really fundamentally transform how you interact with your providers, how you can go to multiple different providers, and everyone will still be coordinated and know what's going on. So our focus is going to be on leveraging our relationships, growing them. We're looking for many, many more startups. We went through 150 startups over the last year and a half. We certainly look for, encourage people to reach out to us when you think you've got something good, whether it's on the device space, the analytics space, or the integration space, please reach out. We're forming new large partnerships that you'll hear about over the year, but there's lots and lots to be done in this space. We're looking at revamping our processes of how we work with startups so we can have much more capability to invest in startups and help them, nurture them through the process. And finally, our internal innovators, we're working on revamping how we align the incentives of the innovators and the inventors along with industry. So I'm going to stop there. We're going to introduce our panel. We have about 20, 25 minutes for a discussion, and then hopefully some time for Q&A. All right?